Welcome to Bite Size Dental Marketing. I have Saurya with me. Saurya, I have changed the lights to honor your wonderful purple hair.
Thank you.
Saurya, it's April of 23. What types of ads out there are we seeing being effective in the dental space?
The types of ads that are doing better in the dental space as of right now really depends by channel. I will say, let's say for search channel where we're doing Google search ads or Bing search ads, the ads that usually perform best have to do with dentist near me or copy that speaks to the general demand for dentistry. Dentist near me, family dentist near me, dentist who sees kids. Those types of ads are doing well on the search ads channel. But if we're talking more branding, which has to do with photo videos being dispersed on social or other channels through Google, I would say the ads that do better are doctor videos as well as patient testimonials. And if we're speaking about specific service ads that are related to specific treatments, then video ads that have to do with different parts or questions about the treatment tends to do well.
Now, you mentioned doctor videos. What a doctor sits down either in some Zoom style video like we're in or face-to-face video or in person. What are the key elements of a good doctor video to you?
The key elements of a good doctor video, specifically for running it as ads, would be that the doctor states his name very clearly and the practice. I think that's so simple, but can be sometimes overlooked, and it's always good to have because not everybody really knows who they're looking at or what dental office they are speaking from. And the other portion of it really would be to make it conversational and add a little bit of the doctor's personality or to exude confidence. Just be the doctor being confident and speaking as if they would speak to a patient, I think is a key element to making any good doctor video.
So are there any doctor videos out there that you've worked on recently that you really like?
Yeah, the one that comes to mind really is of this dentist that we have up in San Francisco. His expertise or the treatment he likes doing are Botox for TMJ, and there's this video that we captured of him where we had him in an interview style, just like we are right now in a video interview, and we got a small clip out of him talking about Botox and how it helps TMJ. And that small clip has been edited into a portion that fits the social space, and it's also going out to YouTube, and that clip is doing really well. It's just him talking about a simple topic that relates to the problem or the treatment, and it seems to be capturing a lot of attention.
Now, when you're judging the effectiveness of a video ad, what are some of the things you're looking for?
The main thing that we're looking for is the view rate. What that is once the ad is being served to somebody, what percentage of people are actually watching the video? Are they clicking on it, watching it? And I guess the next metric would be if they're clicking on it. Although when it comes to video ads, it's very different than search ads. We cannot really judge the effectiveness of a video ad through just the amount of clicks it gets, because not a lot of people. Or the conversions where they convert into being a website visitor through the video. It's more so the engagement with the video itself. What percentage of the video are people watching? And we can look at the graph where it's showing us the percentage of people and the drop off, where you can see how far along are people watching and where are people dropping off. And I think the engagement portion of it is really what we look at.
Yeah, I like that because I've always liked the graph that shows the drop off, because while I don't think in a single video it tells you too much, I think as you look across the portfolio of dentists we have and across the portfolio of videos we have, we can see what questions, force people to drop off and what questions, continue engagement. But
right. Yeah, absolutely. And these videos are not only good for ads, but also patient education, because the same dentist that I was talking about recently mentioned to us that his existing patient who comes in for cleaning and their regular checkup saw his Botox for TMJ ad and came back to his office and asked about that because he said that he saw the video where he was talking about it. So it's not only about trying to capture new people, it's also educational to patients that you're already seeing who might not know more about the treatment.
No, that's great. Now, what do you think when you look at the paid media of display ads, search ads, and video ads, what do you think, how do you like to incorporate them into the strategy? Like talk me through just for a good fee-for-service office, what your strategy is across those three channels.
So the strategy for those channels do vary by office, and I would also say by need. Outside of just the type of office that it is, it could be that the dentist specifically wants to focus on this one service over the other. So we take all of those things into account when we're coming up with a strategy to deploy. But in a regular case where we're trying to focus on more patients through the door, using some of the general dentistry advertising, we tend to focus heavily on search ads for capturing the demand that's already there where somebody's already looking for a dentist. But in terms of the branding side of things, I think the social ads that we run on Facebook and Instagram are a very helpful tool because we're able to retarget people who have visited your website. And specifically, if we are wanting to highlight one service over the other, we can retarget visitors who have visited that specific page on your website or visitors who have interacted with your videos that have to do with that specific treatment. So we're hyper focusing on people who have already displayed that they have an interest. So that is how we would use those channels, is to reinforce demand.
So if someone visits a sleep apnea page, we can make sure as they're browsing around the internet, or Facebook and Instagram specifically, I guess, that they're getting the sleep apnea videos and the sleep apnea creative, right? That's awesome. Right,
exactly. So we're really hyper targeting on people who we already know are interested.
Well, Saurya, it's been wonderful to have you on, and that's your Bite of Dental Marketing.